If you're living with stage 4 non-small cell lung cancer and your doctor mentions a brain lesion, the next conversation will probably be about radiation, specifically gamma knife or cyber knife. I've had 4 rounds of brain radiation using 2 different techniques, 2 different cancer hospitals since my diagnosis in January of 2023. Both worked, but the experience and the logistics and the setup were very different. In this video, I'm going to explain those differences clearly so that if you ever need this treatment, you understand exactly what to expect. Before I start talking about the differences between CyberKnife and Gamma Knife, I want to give you a little bit of background around my own lung cancer journey, especially if you are new to my channel. So, hi everybody, I'm Tina Powell. I was diagnosed with stage 4 non-small cell lung cancer, exon 21 L858R mutation in January of 2023. And from the beginning, brain MRIs and active surveillance was part of the protocol. So in the beginning, I was having brain MRIs with contrast every 6 months. Then, when they found the first lesion, which I will tell you in January 2024, about a year after I was diagnosed, they moved the surveillance and the brain MRIs to every 3 months. Now, I'm presently in a clinical trial at Memorial Sloan Kettering, and I'm getting brain MRIs every 6 weeks. So you might be getting them a lot different than my situation. So it's important that you know that your oncologist and radiation oncologist, they will plan your brain MRIs according to you. Just to give you that background information, in January 2023, that was when I was first diagnosed. In January 2024, about a year later, that's when the first brain lesion appeared. And you'll remember from the beginning of this video, I talked about that I've had 4 brain treatments. I've had 4 brain radiations. So here is the timeline in case you're curious. January 2024 was Gamma Knife at Penn Medicine. February 2025 was Gamma Knife at Penn Medicine. April 2025 was Gamma Knife also too at Penn Medicine. And then in September of 2025, I am being treated at Memorial Sloan Kettering with MSK Precise, which is similar to CyberKnife. It's Memorial Sloan Kettering's their own version of it. So the first 3 were Gamma Knife. The 4th was delivered using a Linux-based system similar to CyberKnife, and I'll explain in a little bit what that means. So, what is Gamma Knife? Gamma Knife is a form of stereotactic radiosurgery. The physicians and the oncologists and the radiation oncologists, that you'll hear this acronym SRS for short, stereotactic radiosurgery. That's what that acronym means. But Gamma Knife specifically, important to note that it is a registered trademark of a Swedish company called Elekta, listed on the Stockholm Stock Exchange. So when you hear the word Gamma Knife, it is being used for a certain type of trademark system called Gamma Knife. More than 30,000 patients safely undergo Gamma Knife each year, and the method has been utilized since 1968. I bet you didn't know that. I didn't know that as I was researching this video. But despite the name Gamma Knife, it's not surgery in the traditional sense. So there's no incision in a Gamma Knife surgery. Nobody's opening up your brain to do surgery on it. Gamma Knife specifically focuses on 201 precise beams of radiation that go directly to the tumor. Individually, the beams are too weak to damage healthy tissue, but together they converge from all of those different angles to treat one single point. So it does deliver high dose radiation to the brain. It is precise, it's targeted, and it is widely used for small brain metastases. But now here's the difference between Gamma Knife and CyberKnife, which we're going to talk about. Gamma knife, and you could see right here, I'm showing you, uses a frame. So the frame is part of the experience that's really, really important here. The frame is also fixed to the machine. So as you're in Gamma Knife, you are not moving. That frame literally, and you could see here from this video again, gets screwed into your head. So I know that's a mouthful, and I know that's a lot to, it's a lot of information to handle all at once. Let me explain to you a little bit about the experience. So on treatment day, the first thing that you're going to do is being ushered into a room where they are going to install and literally screw the frame. So, one of the most incredible things about this whole frame being screwed into my head, number one, is that you are under anesthesia. So, I promise you do not remember a thing. You are under anesthesia for about 10 or 15 minutes while they screw on the frame. Right before they screwed the frame, there was a tray that had literally like a flaming red screwdriver on it. So it doesn't break your skull, but it does actually break the skin. So really important for you to know. And that frame, as you can see here, your head is completely immobilized so that radiation can be delivered with extreme precision. It is why you cannot move when you have that frame. Okay. This is typically done in one session, as it was done for me. It was done in one session. And I felt the weight of the frame. It's a lot. Like when you wake up and you have this big contraption on your head, it's like, whoa. So, I definitely during the experience could feel the weight of the frame. And I even felt a little bit woo woo from the anesthesia. So, after they install the frame, they're also going to give you another brain MRI. And they want to do this just to be sure. So, the next thing, they're going to install the frame, they're going to give you a brain MRI, and then you're going to wait, which is what you see me doing over here.
Hey everybody, Kim is taking such great care of me, Dr. Cahigas, the whole team here, and now we're just waiting for the MRI results, and then we'll go for Cyberknife, and then maybe the parade. Haha, not really. We won't be going to the parade, but it's been great here. Thank you.
So that Gamma Knife treatment, for me, it lasted less than 15 minutes. So the treatment itself is short. You don't feel a thing other than if you are having Gamma Knife, you definitely feel the weight and you feel that your head is completely immobilized. But other than that, you don't feel a thing. So after that 15 minutes, then they wheeled me back to the room. And then a short time after that, they unscrewed and took off the frame. So they literally have two people, two nurse practitioners, one on one side and one on the other, both with screwdrivers who unscrew it basically at the same time. That I felt, a little bit of pressure. I'm not going to lie, but it was definitely relief uh, to get the frame off my head. And then I was able to leave. And you can see in this picture right here, they actually bandage you up because there's four screws. There's one over here, there's one over here. So two in the front and two in the back. So they gave you that bandage to just make sure. And then you're not able to wash. They don't want you showering or doing anything with your hair for a couple of days. Let's talk about the side effects of Gamma Knife. Well, the procedure takes about half a day from the time that you check in for Gamma Knife to the time that they admit you, and then they do that brain MRI, and then bring you in another treatment, and then put on the frame, and then disassemble the frame. I was at the hospital for nearly half a day. So that is one of the side effects, something that you have to keep in mind. My head was definitely sore where they screwed the frame in the head. And I should also mention they put topical anesthesia. And you could also too ask them for more anesthesia. So there was one spot I remember that I felt a little bit uncomfortable, and so they put a little bit more anesthesia there. In terms of how you feel, for me, fatigue set in about a week or two later after the procedure. And that fatigue usually sets in about 5 or 6 o'clock is the witching hour. Like all of a sudden that week you might notice that you want to get in bed and go to sleep at like 6:30 or 7. So that was the gamma knife procedure. So, CyberKnife is also a form of stereotactic radiosurgery. CyberKnife is also, too, a trademark system, this time by a company called Accuray. And Accuray develops and they manufacture and they sell radiotherapy systems that make cancer treatments shorter, safer, personalized, more effective, and ultimately enabling patients to live better and longer lives. This from their website. Their corporate headquarters is in Madison, Wisconsin. They're based in the US, and you can find them in on the NASDAQ listed. The symbol is A Array. ARAY. And then you could see a picture here of what their CyberKnife system actually looks like. So I didn't have CyberKnife at Memorial Sloan Kettering. I had their own version of it, which they call MSK Precise. So the difference, if I compare and contrast that to the beginning gamma knife surgery that I had, MSK Precise still uses that stereotactic radiosurgery, but they use a robotic arm with a linear accelerator called a linic that's mounted directly on it. So what happens is that you're laying down and the robotic arm moves around you at different angles. So it delivers radiation from different angles, sometimes hundreds or even thousands of beams at a time. One of the differences here between the MSK Precise or their version of CyberKnife to Gamma Knife is instead of my head being having a frame literally screwed onto my head, they used a mask. So the difference is how they immobilize you. So instead of a frame, what they did was I wore a custom fitted mask that kept my head still. Let me also explain how that mask was created. When you have a cyberknife, or in my case again, MSK Precise, when you have this type of treatment done, you first need to go for a staging or planning session. And that is where they fitted the mask to my face. So it felt very much like a facial. I'm not gonna lie. It felt like there was a warm washcloth going on my face, and then they pushed it. I swear, it felt like a facial in a good way. It wasn't terribly hot. It wasn't terribly uncomfortable. They put it on and they molded it to my face the day that they perform that procedure. And again, instead of my head is stationary just like it was for gamma knife, but it's just using the mask. And so that mask actually, is screwed on into the table so that you can't move. So in both cases, you can't move. But the MSK Precise system is a Linux based stereotactic radiosurgery platform. So it is outpatient, it's highly targeted, and then it's designed like Gamma Knife to spare as much healthy tissue as possible. Both of those procedures are designed to be very, very precise. So I'll talk a little bit about the experience of MSK Precise so that you know how to compare and contrast that. So again, number one, first I had the staging appointment, and that staging appointment was used for that custom fit mask. It wasn't uncomfortable. They made it very pleasant for me, and it felt very much like a warm washcloth or a facial over my face. The following week is when I had the actual treatment. So instead of being half a day, which my gamma knife was because I had to get there, they had to screw the frame on, and all of the other things that happen, the MSK Precise was very, very quick. So I went in there, they fixed me to the table. And then again, that robotic arm came over me at different periods of time. It was very interesting, you guys. It felt very futuristic. So in this case, there was no bandages. I had no anesthesia. And like Gamma Knife, I felt absolutely nothing. It was pretty cool, actually. This robotic arm, I remember thinking how incredibly futuristic and how incredibly fortunate I am for able to have this MSK Precise to deliver this brain radiation. So the side effects of the MSK Precise was very similar to the first three experiences that I have with Gamma Knife. So first of all, the procedure was short. Maybe I was there for maybe 90 minutes instead of half a day. So that's really important to recognize. My jaw was a little bit sore because, again, this mask was totally, totally tight. And although I couldn't talk, you have the airways. So you can see right here the mask. So breathing in it is pretty easy. I didn't feel weird at all. I felt actually very, very safe. But my jaw was a little bit sore because it kept my face in pretty tight. So the fatigue, like the first procedure, definitely set in like about a week or two later. I can't remember exactly if it was a week or 2 weeks, and the same type of thing. Like I felt like going to bed really, really super early. So the fatigue definitely set in. Again, both procedures were highly effective. And I would do both of them, even though the first procedure was a little bit arduous with the frame. Both procedures were very successful. So you're probably wondering, like me, like, well, how do you determine whether or not that you're doing a gamma knife procedure or a cyber knife procedure? That's a great question. Hold that thought. So the difference between both of those systems often depends on the hospital or the cancer center itself. So you have to ask your oncologist and your oncologist radiologist, which of those two technologies do they use at your particular cancer hospital? So that's number one. Number two is the decision has to do with the radiation oncology team. And I leaned in heavily and trusted the opinion of my radiation oncologist. I still do. So that's also a consideration. The tumor size and location can also to affect the treatment. As you know, I'm not a medical doctor. I'm just sharing my experience of what it was like getting 4 rounds of brain radiation, the first three using gamma knife, and the last using a technology that's similar to cyberknife. And then also clinical judgment. What is your oncologist, what does your entire medical team say that you should do? So you need to get a second opinion. We had talked about that here on Lung Cancer Strong. Don't be afraid to get a second opinion. If this is a situation that you find yourself in, originally I was really freaked. I'm not going to lie, you guys, I was freaked. But the people that worked with me throughout both of those facilities were actually very well trained, and they had a lot of empathy and a lot of consideration. They told me what to expect. So I felt very safe in both of those hands. So both of the procedures, both CyberKnife and Gamma Knife, utilize a radiation oncologist who is going to oversee the plan. And regardless of the technology, that radiation oncologist is one of the most important people as it relates to both of these procedures. Also, something that I learned, which was really cool, is that in both cases, they use a medical physicist. I never even knew that there was a medical physicist. So, a medical physicist is the one who designs and verifies the radiation plan. They calculate the dose and distribution, and they ensure sub-millimeter accuracy. Again, a medical physicist is on for both of those procedures. With Gamma Knife, as I had at Penn Medicine, there was a neurosurgeon, and that neurosurgeon was actually the person that screwed on the frame. So I had a neurosurgeon present the day of my Gamma Knife procedure at Penn Medicine. When I had MSK Precise done, the radiation oncologist was not there. The medical team that he entrusted obviously was there. So both are established, both have strong clinical data, and both are considered precise radiation options for treating brain metastases as it relates to non-small cell lung cancer. So there you have it. My experiences with brain radiation utilizing two different types of treatments administered at two different institutions. So I hope that walking you through this actually makes you feel a little bit more prepared and hopefully a lot less anxious than I was. So if you find yourself needing this treatment or having this conversation with your oncologist, you won't be so freaked out. Naturally, if you have any questions about my personal experience, I'm not a medical doctor, but I am just sharing it from the patient's perspective. You know that you can all reach me at tina@lungcancerstrong.com. I appreciate many of you who've already reached out and shared your own situation. I'm so happy to meet you, and I feel so honored and privileged that you're part of my channel. And as always, I appreciate you watching, subscribing, and leaving a comment. So I'm wishing you luck on your own cancer journey, one breath, one story, one day at a time. This is Lung Cancer Strong.